Welcome to the Sport and Exercise Research Centre seminar series. So for those of you who are aware, we have 4 primary strands, themes within the Sport and Exercise Research Centre. We have a sport performance strand, we have a inclusivity in sport, we have a brain injury in sport strand, and we also have this physical activity, health and wellbeing. So quite a broad one, which I lead, and then it's various individuals within the Department of Sport, Exercise and Health who contribute to this research strand, academic colleagues, also PhD students, MRes students as well. And hopefully at the end of this session today, it will stimulate some discussion, and hopefully there'll be other colleagues from across the Faculty of Health and Wellbeing and beyond that who will hopefully see some synergies with us, and we might be able to look for some collaboration. And I can see a couple of people on the call, such as Dave Wilson, whose research will ultimately, or could well, feed in nicely to the work we do. So the plan for today is basically to provide a bit of an overview, I guess, in terms of some current research that's been undertaken within this research strand, and then look towards how we can collaborate and hopefully grow this sort of program of work, I guess, going forward. So we have 4 presenters today. We were originally going to have 5. Andy Reid, who is one of Scott and my PhD students, he's currently preparing for his upgrade, and time commitments basically meant that he wasn't going to be able to dedicate sufficient time to this for today, but I will be touching upon his program of work from his PhD in this first presentation. So I'm going to kick things off, just providing a bit of an overview. So if you came to our seminar series launch back in October, some of those slides are going to be very similar, but it just provides a bit of an overview of some of the current research or recent research that we've been involved in current research projects. We're then going to move on to Scott, who is a senior lecturer in exercise physiology here within our department. And he's going to be providing a presentation on exercise, calcium and bone, exercise-induced bone loss, which links into some of his PhD research. We're then going to move on to Eloise. So Eloise is a PhD student and also our exercise physiology laboratory technician, and she's going to be presenting some work from her PhD on the agreement between 2 measures of arterial stiffness, so looking at vascular measures in chronic stroke patients. And finally, we'll move on to Nick Hudson, who's currently doing a research study, soon to finish, at least the experimental group, where he's looking at the effect of interrupted and uninterrupted sitting on vascular health and cognitive parameters in patients with a clinical diagnosis of long COVID. Following these 4 presentations, and each will be around about 10 minutes or so, will then lead to hopefully some informed discussion with the audience around potential collaboration, growth, and where we could start to take this body of work, I guess, this program of work forward in the future. So the first thing I'm going to sort of touch upon is some examples of evidence synthesis that have been involved within our physical activity research strand. So a lot of this is research, I guess, aligned, associated with some of my primary research interests. So a couple of sort of fairly substantial pieces of work that have been published in the last couple of years was during the COVID pandemic, or just prior to COVID, actually. I was invited to join Rod Taylor on his systematic review and meta-analysis that's looked at exercise-based cardiac rehabilitation for coronary heart disease. This is basically the 5th iteration of this program of work, whereby it's a real comprehensive analysis of the effectiveness, basically, of exercise-based cardiac rehab on a whole range of clinical outcomes. So this is work that's been published last year in the European Heart Journal, and also in the Cochrane database. It was officially a Cochrane review. It was sort of commissioned by the Cochrane review. Already the Cochrane review was published in 2021, I think it was, and it's already led to 280 citations. So it's a bit of a, as Rod would call it, a citation classic. So what's the sort of the nuts and bolts of this review? It sort of feeds into the narrative about the importance of cardiac rehabilitation. We know that cardiac rehab has sort of been implemented really from the 1970s onwards, but there's only really a couple of of well-controlled, randomized controlled trials from the 70s that are actually included in this meta-analysis. But basically, this body of work includes 85 randomized controlled trials, nearly 24,000 patients, all with a clinical diagnosis of coronary heart disease. And they've basically demonstrated that those individuals that engage in structured cardiac rehab lead to substantial improvements in quality of life, and also substantial improvements in terms of a cost-saving mechanism in terms of cost effectiveness. The review has also demonstrated through various relative risk analyses that engagement in cardiac rehab leads to favourable changes in cardiovascular mortality, or reduced risk in cardiovascular mortality, reduced risk in myocardial infarction, and reduced number of hospitalisation and hospital admissions. And I guess the latest version of this, that basically where I come on board, was published 6, 7 years after the previous sort of iteration of it. And there's definitely been more research also in more low and middle income countries. So that sort of translational knowledge from more westernized countries into more low and middle income countries is also starting to come about with regards to this cardiac literature. So using this as an example of a forest plot that's published in the article, this basically demonstrates that those individuals who engaged in a structured cardiac rehabilitation program basically reduced the risk of cardiovascular mortality by 26% compared to those individuals who wouldn't engage in a structured cardiac rehab program. So a cardiac rehab program is very much physical activity, exercise, and educational components to support patients in their journey in terms of the management of their symptoms post cardiac event. Also showed favourable outcomes in terms of quality of life, in terms of changes in both physical and mental components of health, as demonstrated here through research studies that utilise the short form 36 as a measure of quality of life. So not as much evidence in terms of papers that have administered that tool, but it's something that is starting to be incorporated, let's say, in terms of this review. So this is quite a cool review that's been published, and I'm sure there'll be another version of this in probably 3 or 4 years that looks at updated papers. Other sort of examples of evidence synthesis from within our sort of research team, I guess, includes work by Lev Karanasius. So Lev is one of our PhD students, supervised by Scott and myself. And Lev is initially looking at the acute effects of resistance training on arterial stiffness, with potential applications of looking at how resistance training through acute and chronic exposure, so a longer term exercise program, may lead to improvements in vascular health in clinical groups as well. We're not there yet. We're looking at more young healthy at the moment, but Lev published this last year in the Journal of Trainology, and more recently a body of work that we're working towards, again led by Andy Reid, one of our PhD students, is looking at the effect of robotic assisted gait training on physical activity levels during and post rehabilitation for people with neurological conditions. So this is a huge systematic review and meta-analysis that Andy is undertaking at the moment. At the moment, we've probably identified approximately 120 research papers that fit into this scope of looking at physical activity. So physical activity levels in terms of what's actually administered within an intervention hasn't really been systematically presented or understood, let's say, up to this point. So we're trying to explore the effect of I guess fit principles around the dosage of physical activity using robotic technology with neuro groups. I think there's going to be lots of different ways we're going to chunk and analyze this data when we get to that point. We're currently extracting the data. We're probably going to be looking at papers around specifically relevant to stroke populations, spinal cord, and maybe some other work around maybe MS, depending upon the number of papers that are going to be identified. And then the plan from this is to develop this systematic review and hopefully do some meta-analytical work and look at how changes in physical activity over the course of a given program may lead to favourable changes in certain functional outcomes in these different neurological populations. So maybe looking at changes in the 6-minute walk test, incremental shuttle walk test, timed up and go, balance measures, etc., etc. So this is a current trial that was registered on the Prospero registry, and Andy is currently working diligently to get on top of this particular review. Other examples of recent research highlights, I guess, from the last few years is myself and colleagues from Winchester sort of led a large international study looking at the associations between physical activity, mental health and well-being. So from the Winchester perspective, we had myself, John Batten, who was instrumental in helping to formulate some of the measures, outcome measures that were being included in the particular study, as well as Helen Ryan Stewart, who was a former colleague with us. We led this program of work that basically led to a couple of pretty impactful publications, I guess. One was published in the Journal of Science and Medicine and Sport, which in 2021 was the most read and cited paper in that journal. Again, it's been cited quite a lot. It's been cited around about 270 times in the last few years. And it then led also onto some other research, looking at those associations between physical activity, mental health and well-being, not just during the lockdown period of COVID, but also when those restrictions were lifted. And what you saw is demonstrating that those individuals who engage in higher volumes of physical activity have more favourable responses, let's say, in terms of mental health, as demonstrated by the DAS9, the depression, anxiety and stress scale, and also through the WHO-5, which is a measure of well-being. So those who are engaging in higher volumes of physical activity are having more favourable responses both during lockdown and outside of lockdown in terms of mental health and well-being. Where that sort of led to was a little bit of collaborative work between myself and colleagues at the University of Southampton through some ARC Wessex funded research that started then to look at the application of this sort of or exploring the association, let's say, between physical activity, mental health and well-being, but with individuals of specific long-term conditions. This has led to this particular publication in the International Journal of Environmental Health Research. We've currently got another paper under review with BMJ Open as well, that's looking at more so a mixed methods approach, qualitative and quantitative data, looking at the importance of physical activity or perceived importance of physical activity within different periods of the COVID pandemic. What this also led to, I guess, is some impact work, whereby it led to a policy brief, which was then disseminated out to lots of different stakeholders, including parliamentary committees, and has led to some conversations around how physical activity could be beneficial in terms of supporting other people in other forms of isolation. So it's led to a couple of conversations with some prison service around how physical activity could be beneficial in managing mental health and well-being within an isolated community such as within the prison. Whether that leads to anything, we'll wait and see. And it also led to me being invited onto a report, a national report, COVID-19 report between the Physiological Society and the Centre for Aging Better, which was basically a post-pandemic resilience program around how physical activity could be beneficial for individuals going forward when you're sort of living within a pandemic type environment. Other clinical research that's been ongoing, I guess, is the Help Hampshire Stroke Clinic. So this is a community-based exercise and education initiative whereby we work closely with Hampshire Hospitals, NHS Foundation and Trust to try and support stroke patients and TIA patients in the management of their symptoms in their recovery and their journey post-discharge from the NHS Trust. This has led to some collaborative work, which Matt Smith has led, looking at understanding patient experiences to engaging with face-to-face, group-based, community-based exercise classes. That's led to a nice little publication there, which also included one of our MSc students. It also underpinned one of our REF 2021 impact case studies, and has also underpinned a current IRAS ethics approved study, so a Health Research Authority NHS research study, whereby we're looking at a non-randomized control trial exploring the effect of engagement in this type of community-based program on quality of life, physical activity, mental health going forward. So that's a current study that we're currently running. Other publications that we've had in recent years has been to look at, again, some robotic technology work. So the effect of robotic assisted gait training on vascular health in patients with spinal cord injury. So patients who have SCI are at heightened risk of mortality through basically cardiovascular disease due to a decrease in cardiac functioning over a prolonged period of time. This particular study demonstrated that if you engage people in acute exercise exposure, 5 bouts of exercise on repetitive days, you can see a huge change in some favourable vascular outcomes, one being augmentation index, which Nick may or may not, or Nick and Eloise may or may not discuss in a bit more detail later on. Another one is PhD work associated with some stuff by Amy Wright, whereby we looked at the effect of home-based use of robotic technology on various biomechanical parameters, and also again on some vascular health, and this is a publication in Frontiers. Other sort of work within the area, within the theme of physical activity, we have mental health and well-being, so it's not just about physical activity. Is some work again by Matt that's looked at examining predictors of mental health in e-sport competitors, and also we have some work there by Matt and John looking at the effect of looking at examining self-presentation and body image of young collegiate females. So there is a broader scope, I guess, rather than just purely around physical activity, exercise, vascular health, and sort of robotic technology. I'm very keen to expand the areas of research that we do within this centre, so really keen to collaborate with lots of people going forward, but we'll talk about that in due course. What are some of our current research studies? So currently collaborating with Zoe Sainer from the University of Portsmouth, looking at a qualitative research study around enabling a paediatric population in terms of their perceptions, barriers, facilitators to engage in exercise when they have a clinical diagnosis of Crohn's disease. And Andy Reid, as I sort of touched upon already, is just about to start a research study in collaboration with Hampshire Hospitals NHS Trust and the University Hospital Dorset, so Bournemouth Hospital, which is going to be looking at the effect of robotic assisted gait training on vascular health and physical activity in acute stroke patients. So this is in the inpatient phase within the Royal Bournemouth Hospital. They're the only NHS trust in the country that has a locomat, and we are keen to examine if we get these patients who have had a very disabling stroke, so they may be completely immobile post-stroke, and that might mean that there's substantial they require substantial therapy support on the ward, and they might be on the ward for 6 weeks, 8 weeks, etc. Can getting people immersed in using robotic technology such as a locomat, can that be favourable in terms of vascular health? Could it lead to favourable changes in discharge time, etc., etc.? So we're doing a little bit of exploratory work there. He's already done a bit of a service evaluation that he's writing up for publication, and is due to start this randomised controlled trial in well, ASAP, basically, hopefully within the next couple of months. Other examples of some collaboration with Hampshire Hospitals NHS Trust. The first 2 bullet points here basically lead to collaboration with Dr. Harry Griffin, who actually comes from a sport and exercise science background, but is the lead respiratory physiologist and sleep specialist at the Trust. And we're doing some work with patients with a clinical diagnosis of a respiratory disease. One is around a sort of a methodological approach, I guess, looking at what's the most efficacious form of a certain exercise test for respiratory patients. And the second one ties into just the recent submission of an MRes student, Zoe Finley, who also works in Harry's team, which is looking at a hypoxic challenge test in patients with respiratory disease, looking again at more of a methodological approach in terms of whether a mouthpiece or a face mask is a better tool to use when undertaking what's known as hypoxic challenge test. And finally, on the HHFT front, Amelia Shaw, so a colleague in the physio team and also a PhD student, is just about to start a research study looking at vertical perception loss in people with acute stroke, and that's going to be a feasibility study.